Hello, my name's Andy Walker and I'm a pharmacist undertaking a clinical leadership fellowship which is supported by the West Yorkshire ICB Cancer Programme. Thank you for taking an interest in participating in this pilot project which has received funding from the West Yorkshire Cancer Alliance. In this pilot, we are looking to investigate the potential for community pharmacy to help identify and signpost patients with symptoms of possible lung cancers which require investigation, and to signpost those patients towards the Leeds-based self-request check X-ray service. Now what that means is that patients would not need to make an appointment with their GP to access diagnostic scans to help identify lung cancers. This service is supported by the West Yorkshire ICB, has been supported by local GPs, and is supported by the Leeds Teaching Hospital Radiology Service.
My name's Steve Bradley. I'm a GP and I'm the clinical lead for cancer for the Leeds office of the West Yorkshire Integrated Care Board. We're delighted that you're interested in taking part in this scheme to signpost patients who have symptoms that could be lung cancer for a self-request chest X-ray. The service has quite a long history in Leeds and it's been really successful. It's very much supported by GPs in the city, and I'm very supportive of it as well personally, and we'd be delighted if you would consider taking part.
I'm Bobby Bartier. I'm a chest radiologist in Leeds Teaching Hospital and I'm the lead for the plain film services. We've been involved with the Self-Referral chest X-ray service for several years, and we've been involved in the development of this project to look at referrals from pharmacists to the self-referral service, which we fully support.
Hello, my name's Professor Matt Callister. I'm a respiratory physician at Leeds Teaching Hospitals, and I've been involved with various projects over the last decade looking at the early diagnosis of lung cancer. One of the things we know about diagnosing lung cancer is that the more X-rays get done in the community, the lower the rates of advanced lung cancer that we diagnose, and that is because we're picking people up earlier, and in fact the lower overall death rates. So there's certainly advantages to doing more X-rays. What we also know from some other research is that many patients who fulfill the criteria for having an X-ray to look for lung cancer, in fact don't get those examinations. And I think one of the reasons for that is that the symptoms of early lung cancer are very common and often are due to other problems such as respiratory tract infections. And so, if you like, are explained away by other things that might be going on. Finally, some very interesting recent research has looked at people who are diagnosed with lung cancer and going back a few months earlier to see what was happening with these patients. And we can spot changes in the rates of antibiotic prescriptions, sometimes 5 or 6 months before they're diagnosed with lung cancer. So we think there is a signal early on in terms of prescribing habits that maybe we can take advantage of in terms of trying to find these cases earlier. And so that's where this project, where community pharmacists can guide people towards these self-request X-ray services triggered by the medications that they're getting from primary care, may be a way to improve outcomes for this patient group.
So the chest X-ray is the commonest test that we perform in the radiology department. We perform well over 100,000 chest X-rays each year. It's a very safe test for the patient. Involves very low doses of radiation, equivalent to a couple of days of normal exposure from the environment. It's available on a walk-in basis and just takes a few minutes to do.
This pilot project will use patient criteria which mirrors that within the wider Leeds self-request chest X-ray service. This is based on national guidance which helps us to define patients whose symptoms would benefit most from a chest X-ray to investigate potential lung cancers. Patients who present to the pharmacy with any of these symptoms should be signposted towards the self-request chest X-ray service using the brief intervention detailed further in this training package. Patients who fulfil the patient criteria outlined earlier should then proceed to receive a brief intervention from a pharmacist or pharmacy technician who has completed this training package. We intend that this brief intervention should only take 1 to 2 minutes, therefore we hope that it will have limited impact on provision of wider services within the community pharmacy team. We would like this brief intervention to cover the points listed on this page, and then we would like patients to receive a self-request chest X-ray card which will be provided to the community pharmacies. This card will have a unique patient identifier which will then be included within the data collection phase of this pilot project, which we will outline in the next slide. In order to help the pilot project team assess the impact of this project, we have received authorization to collect a limited, non-patient identifiable data set. This data set will be captured from participating pharmacies and will be captured using the Pharm Outcome system, which will be hosted by Community Pharmacy West Yorkshire. The data set for this pilot project will be captured using the Pharm Outcome system, and the pilot project team will be supported by Community Pharmacy West Yorkshire to develop a dedicated data collection form which we use by participating pharmacies within the context of this pilot project. This data collection form will include capture of the unique identifier number on the self-request chest X-ray card given to the patient, details of the patient's symptoms, details of the age of the patient within age banding, and details of any medications that the patients had associated with their symptoms. For example, if the patient sought to purchase any medications over the counter to help manage any of these symptoms, we would like you to identify that within the options that are provided. Or if the patient had medications which are prescribed by their GP, which correlate with these symptoms from the list that's provided within the data collection form and Pharm Outcomes, we would like that to be captured within the data set as well. The reason for this is that there is evidence which suggests that patients' medication usage changes in the months prior to a lung cancer diagnosis, and that this might help to act as a signal to inform early identification of patients. Thank you for taking part in the training for this pilot project. We hope that this training has provided you with all of the knowledge that you need to take part. If you have any additional questions, please refer to the frequently asked questions document, which is available at the end of this training package.